Hi everyone, and welcome to this week's mini mental health training. We're focusing on anxiety disorders. With everything going on in the world, people with anxiety disorders may be suffering more than normal and may need extra support. First, I'll go over what anxiety is, how to communicate with someone who has anxiety, and how COVID-19 may be affecting someone who has an anxiety disorder. The DSM describes anxiety as the apprehensive anticipation of the future danger or misfortune, accompanied by a feeling of worry, distress, or somatic symptoms of tension. The focus of anticipated danger may be internal or external. Everyone experiences anxiety at some point, either before a test or a big event. However, that does not mean that everyone has an anxiety disorder. The criteria for an anxiety disorder includes excessive fear or worry persistent for at least 6 months. The person finds it difficult to control the worry. Some people can have physical symptoms such as muscle tension, headache, stomachache, and nausea. There are some different types of anxiety disorders. The first one, generalized anxiety disorder, is common anxiety disorder that does not really seem to stem from a specific thing or fear. Other anxieties, such as social phobia or specific phobias like heights or spiders, also separation anxiety. Other disorders that are associated with anxiety are panic disorders, obsessive compulsive disorder, and PTSD. Panic disorders manifest in physical ways. Identifying someone as having a panic attack can help you communicate better with them. Symptoms include racing heart, sweating, shaking, shortness of breath, feelings of choking, nausea, and fear of losing control or fear of dying. Panic attacks can be very scary for the individual, and speaking calmly and giving the person time is important. Treatment for any anxiety disorder includes medications, either antidepressants or anti-anxiety, or even both. Also, therapy can be very helpful for someone who has anxiety. For in the moment coping skills, there are a lot of different apps, mindfulness apps or meditation apps, and also tactical breathing can be helpful. If you are with an individual who is having high anxiety, it can be helpful to do a quick tactical breathing exercise with them. Have the person breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and hold for 4 seconds. This can be repeated over and over until the person has calmed down. With everything else right now, COVID-19 has increased anxiety in people. Individuals that have an anxiety disorder may be struggling more than normal because they are experiencing a lack of control and increased stressors like a loss of a job or uncertainty about the future. Many people also have had a change in routine or schedule, which could cause an increase in anxiety. Finally, the overwhelming amount of news and information on social media can cause added stress. Reminding people to take a step back from the news and from social media and focus on something else can help them. Some communication strategies to use for someone suffering with anxiety. First thing, try to slow down and speak slowly. Especially if someone's having a panic attack, slowing down and speaking slower can help calm them down. Encourage the person to also slow down and take deep breaths. Step back from the situation and think, what could be causing this? Is it a mental illness? Is it possible substance abuse? Is it situational, or is it a medical emergency? If someone is having a panic attack, contact EMS, ADI to make sure that there is not a medical situation going on. Thank you for watching our mini trainings. Here's my contact information if you need anything, and I hope everyone is staying safe.